So what we'll do is we'll have our presenters introduce themselves, and at the conclusion, pass the virtual baton, as it were, to the next one of our speakers. Our first speaker this afternoon is London Mayor Ed Holder. Mayor Holder.
Well, thank you, Dan, and I'd like to welcome the public from London and Middlesex County, and certainly the press media from around our region and participating today. So the question is, why do we do this? It seems to me pretty clear. There's a volume of information that's out there, and it strikes me that what we need to do is to provide regular appearances to keep our citizens in the loop, and to have an opportunity for the media to ask direct questions as well on a consistent basis. You know, it's interesting, this is no different than what the Prime Minister, the Premier have been doing on a daily basis. And we think that local information matters locally. So we want to cut through the noise. We're going to do this on a consistent basis. We'll provide some detail around that. And we think that Londoners and all the citizens of Middlesex County deserve to know what's going on in their community. Back to you. Now I'm going to, if I might, actually, is ask Warden Cathy Burghardt-Jesson to make a few remarks as well, please.
Cathy, you're on mute, if you want to unmute your microphone. Okay, there we go. Well, good afternoon, and I want to begin by thanking Mayor Holder and Dr. Mackie for organizing today's events. It's important to think beyond the borders of the City of London to what all of this means and the needs, and to meet the needs of the Middlesex-London region. Both Mayor Holder and I have spent a considerable amount of time thinking about the response to our current residents' needs. And I would just like to take this moment to really thank at this time our incredible team of first responders that serve both Middlesex and our London residents. As the provider of the land ambulance services for Middlesex-London, I am fortunate enough to have a front row seat to the daily heroics of our paramedic team, and they certainly are an integral part of this whole situation as it plays out. And every day they put their health and safety on the front line while serving others. There's certainly lots to talk about today, whether it's through social services and the needs of our vulnerable citizens or the economy. So I welcome the discussion as it plays out. And again, I want to thank the Mayor and Dr. Mackie for beginning this discussion. So Dr. Mackie, over to you.
Thanks very much, Warden Burghardt-Jesson, and Mr. Mayor. It's really an honor to be here with you today to present to our community on what's happening with coronavirus. I want to especially note that the inspiration for these daily updates came from Mayor Ed Holder, so thank you to you and your team for that. So there is an incredible amount of public health information that needs to come out each day on coronavirus, and we all thank you very much for attending this briefing today. We feel it's going to be the most efficient way for us to get the message out and for you to receive the message and help get that out. Particularly for the media who are attending today, I want to thank you for the incredible job you've done in covering this really complex issue to date, doing a great job of getting out the really key information and helping the public to see the different layers of issues that are overlapping here, and getting them the right information so they can make good decisions to protect the health of themselves and their families. In terms of format, what we'll be doing for these briefings is after our welcome, we'll do a brief overview of the epidemiology of the disease, so cases and deaths in our area, and catch up to speed on the provincial and national data as well. We'll talk a little bit about public health measures, particularly any new public health measures that have been implemented recently. And then we'll do sort of a key question that we're seeing from the public through social media or other channels. Spend a bit of time talking about that, and look for your help getting that message out. And then we'll be happy to take any questions that you may have through the chat function. So where are we at from an epidemiological perspective today? We have over 40 cases came in over the weekend. So our highest case counts each day, essentially Saturday and Sunday. And then today we only had 2 new cases reported. Part of this is the backlog of lab tests that Public Health Ontario has been essentially resolving. They've been testing many days worth of tests in order to catch up. And so we don't expect that the decline from low 20s to just 2 cases today is indicative of any real slowdown in our area. It's more of an artifact of how the testing has been going. We have had 136 cases diagnosed in Middlesex and London since the beginning of the year. In Ontario, there were 309 cases reported in the last 24-hour period. That brings the total in Ontario to almost, sorry, I don't have that written here. There is a crucial piece of information though regarding the tests in Ontario, and that is around the percent positivity. The percent positivity is the percentage of tests that are testing positive. This is an important marker because it shows, if you increase testing, you will find more cases, there's no doubt. But if you look at the percentage positivity, that helps to eliminate the noise, the background changes in the test positives that would be just due to increasing testing. And the percentage positivity in Ontario has been about 8% for the past week or so. And that's what it was in the last 24 hours. So that means of people that are presenting for testing for coronavirus, only 8% are testing positive at this point. The encouraging thing there is that has been fairly stable for about a week. So even though the case counts have gone up, and they will continue to go up, the percentage positivity has been fairly stable. That's one of the signs that we may be starting to see a decline in the exponential growth. But there's no doubt right now, we are right in the midst of a pandemic wave. This may be the early part of the wave, it may be closer to the peak. That's not clear yet, but what is clear is we are in the pandemic wave now, and now it's as important as ever to take those public health measures, physical distancing, very seriously. The main increased public health measures over the weekend was the announcement of additional business closures. This is a provincial announcement that closed down many construction projects and some retail in that same sector, and maintains infrastructure projects that are crucial for our community's response to coronavirus and for the operation of our community. But for example, no new housing starts as of midnight on Saturday. That will help reduce some of our high volume employers, such as large manufacturing, that are unrelated to the coronavirus response. The question from the community that I'd like to address today, which has come up over and over again, is it okay to go out for a walk? The weather is finally broken, we've got some beautiful spring here, and people are asking, is it all right to be outdoors? The answer isn't an easy yes or no. The answer really is about how well can you ensure that you're protecting yourself and your community while you go on a walk. Some of the risk factors would be, if you have children, are you able to make sure that your kids aren't running off to play with neighbors, potentially being in contact and increasing the likelihood of spread? Can you coach your children, sort of give them enough advice and support so that they can stick to enjoying the beautiful outdoors and avoid potentially contaminating themselves or others. Another factor is around your home environment, and are you able to make it out of the building safely? Lots of high-density residential buildings have put limits on the number of people that can be in the elevator at one time. Many of them are also doing a great job of frequent cleaning of high-touch surfaces such as doorknobs or push bars. But those are the sorts of things that you want to be sure of before making the decision to go outdoors when it's not absolutely necessary. Some other factors: if you were in quarantine because you've recently traveled or you've been in contact with somebody who's a confirmed positive case of coronavirus, it's not okay to be outdoors. If you're in that sort of quarantine after travel or contact with a case, please stay indoors. Please do your best to get the support you need from others, to bring the groceries or whatever it is, and do your best not to go outdoors for your 14-day quarantine period. Also, of course, most important, if you have tested positive for coronavirus, do not go outdoors. Look for support from neighbors, friends, family, whoever you need to. If you're positive for coronavirus, please do not go outdoors. If you have to, reach out to the public health unit. We will try to connect you with volunteer organizations or others who can help get your daily needs met. So that's it from me today. In terms of messages we wanted to make sure to get out, I'm dying to hear what sort of questions we have from you.
All right. Thank you, Dr. Mackie. And now we will hear back again from Warden Cathy Burghardt-Jesson.
Okay, thank you, Dan. I think in listening to Dr. Mackie, I'm going to sound like a broken record, I think, because we all have important roles to play during this crisis. And, what I would say to my residents of Middlesex County, how we act and react and respond today will determine how long our communities are in this. And we all have a role to play, and we can't ever forget that. I'm like everybody else, it's a beautiful day, and I'm fortunate where I live. I can enjoy the outdoors, but I would love to be able to enjoy it with my friends and get back to a more of a social existence. But, as Leo Tolstoy penned in War and Peace, the two great warriors are patience and time, and that's what we have to take at this time. And, I think while it's stressful, we can certainly, there's a lot of opportunity for our residents to reflect on a lot of things, and we can certainly grow from this personally. And all I ask is patience and time. Listen to our health care professionals, and we'll all get through this, I think. So, Mayor Holder, back to you.
Well, thanks very much, Cathy, and I'll just be brief on these points. There's a number of issues that we can all speak about, and those questions may come up as a result of queries through the media. But there's 2 points I'd like to make. The first is to say to the frontline staff of our hospitals, our police, our fire, EMS, our transit, our health unit, our frontline agencies, thank you. You are the front line, but you're the folks most directly impacting and impacted by the individuals we serve. And we're so grateful, all of us, be they in Middlesex County, be they in the City of London. Thank you to all of them, because they matter for the lives of our citizens. And which brings me to the second thank you, which is to our citizens of this great community of London and the county. You've been great. You've been cooperative. You've been supportive. The acts that you do save lives. Some of the things you've heard our medical officer of health talk about in terms of the proper health practices saves lives. Where do we get that chance? Where do we have that opportunity where we can by virtue of the activities we undertake, and in some cases don't undertake, make a difference in saving people's lives. So thank you for the cooperation. It's been unprecedented. We don't know how long we're going to be in this. I think that may come up as part of our Q&A, but let me say that your continued support does matter for all of our sakes, and from a heartfelt thanks, I know, from all of us.
All right. Thank you very much, Mayor Holder. Thank you, Warden Burghardt-Jesson. And thank you, Dr. Mackie. We do have some questions that are coming in from the media. So what we'll do is I will read the questions and direct them to the person who would best be able to answer them. And then I know the media are watching and are taking some clips or recording. So if we could have the folks who are answering, if you could unmute your microphone, and Lori, I know you're listening, so if we could get the person who's answering the question on, and then we'll go from there. So the first question is from Dan Brown at the London Free Press, and it's one that I can answer. Will the public be able to see these briefings? And the answer, Dan, is yes. We're going to be posting a recording to our website, and I know that the plan is for the city to also have a recording on their website, and we're looking into making them available on YouTube as well for people. So the answer to that one is yes. Next question, this one is for Dr. Mackie. And Dr. Mackie, this is from Scott Navarro at Rogers Television. Dr. Mackie, the province released their best worst case scenarios for COVID late last week. Do you have any local projections?
Sure do. Local data is incredibly important. Before I answer that, I want to again thank the Mayor and the Warden for being involved today. London is, and Middlesex are an example of what makes our country so strong. When rural and urban can come together, we bring the best of both worlds. And so very thankful for your comments today. On the question of local projections, modeling is most useful for helping us to determine what we need to do now. The numbers the models come up with are always highly variable and highly susceptible to the choices that we make and the assumptions which we need to essentially make in the absence of data. So they can be very complicated and often, somewhat accurate guesses, but they are still guesses by their very nature. And so what we've done with the provincial modeling data is we've used London and Middlesex's combined population to estimate what the impacts might be here. So Middlesex and London together compose 3.01%, so basically 3% of the provincial population. So if you take those provincial numbers and multiply them by 3%, you get roughly the sorts of numbers that we're looking at for here. Again, modeling having all those limitations. What is really clear, regardless of how much faith you put in the actual numbers, is that we're in a pandemic now. Those numbers are going to get bigger. We are going to see many more cases and unfortunately more deaths in our community. And it is up to all of us to act now to prevent that as much as we can by staying home to stay safe, staying home to save others' lives, and taking those physical distancing measures seriously.
Thank you very much, Dr. Mackie. A follow-up question from Scott Navarro at Rogers Television. This one is for Mayor Holder. Mayor Holder, are you surprised by the number of COVID-related fines and provincial offenses that were handed out this weekend?
Thanks for the question. The answer is no, I'm not surprised. It's been interesting. We've used education through the health unit and through Dr. Mackie and through our own communications resources within the city. And I'll only speak to the city in this particular situation because it's there were a number of bylaw charges laid in the city itself. So what happened was we've been really good in terms of our bylaw enforcement officers for reminding people about the rules. and be they in terms of recreational facilities, be they in terms of self-distancing, but primarily around recreational facilities, skateboard parks, and the like. And it was really clear to us that the time for education is never over, but the time to make the point for those who are not prepared to listen had to begin. And if people weren't prepared to listen, then perhaps their bank account might. And it's one of the only tools that we have. And so 21 charges were laid over the weekend as a result of patrols that were exercised. By the way, a number of warnings as well were given without any charges laid. But these were blatant offenses. And so the charges were laid, and it's not cheap. The minimum fine is $750. And it's sad when you have to do that, but sadder if we didn't, because of the implications associated with inappropriate conduct that can impact the health and safety of others. So those who choose to congregate, here's one of the issues. You know, you might get a bunch of mates that get together and they decide it's fine and fun to spend time together, but then they go home to their respective places. Perhaps their parents. Perhaps their parents later visit their grandparents. And if you've been the one who was impacted initially and then you become the source point of COVID, that has a dramatic impact on your family. And you do not want to be the one responsible. So here's the great news. Yes, we know the 21 charges were laid. I will tell you that for the most part, we've had phenomenal cooperation amongst London citizens, and for that, we're very grateful.
All right, thank you very much, Mayor Holder. Our next question is from Carrie Mackie at CBC London, and Dr. Mackie, this is a question for you. I've heard gastrointestinal complaints are a symptom of COVID-19. Is this true? And if so, why is it not included in the online self-evaluation, or do the gastro issues coincide with other flu-like symptoms?
Yes, so great question around symptoms and whether gastrointestinal symptoms like nausea, vomiting, diarrhea can be part of coronavirus. We are seeing that there definitely can be, especially early on, some gastrointestinal symptoms like diarrhea that are related with coronavirus. Some case reports have reported as many as 50% of cases may start with gastroenteritis. That said, they're not the hallmark cases, whereas like cough and fever, for example, are present in 90+% of cases. And so it's not the definitive function, and it's not actually clear that the virus can be spread fecal-oral. So in most diarrheal diseases, the spread is fecal-oral spread. You get a bit of feces on your hand, and you pass it to someone else, and that's how they get sick. That's how norovirus, for example, spreads. And it's not clear that can happen with coronavirus. So as much as it may be a feature, it's not necessarily a defining feature. The question that there's sort of a sub-question about, is that captured in other flu-like illness? Technically, yes, because influenza actually can cause gastrointestinal symptoms in many people as well. In fact, in birds, where often new influenza viruses are kind of created before they travel to human. In birds, influenza is a fecal-oral disease. It's not a respiratory disease as it is in humans.
All right, thank you, Dr. Mackie. We're going to go back into the questions. This is from Celine Zadorsky at CTV, and Dr. Mackie, this is another question for you. Is there a projection as to when the peak will be, and what will it possibly look like for our community?
Sure. So the short answer is no. We don't know when the peak will be. It's possible that we are near the peak now, or it's possible it may happen weeks from now. The data, because of the way it's reported, there's a delay between being exposed and becoming sick, and B, there's delay in the lab testing being sought, and then the results coming back. What that all means is that we don't have perfect data to tell you where we are in the epi curve, where we are in whether we're at the peak or not. The best guess is the peak will occur in the coming weeks, and that we will continue to see significant rise in cases to several times greater per day than we have now. The other thing we know for sure is that we will see more deaths, and deaths tend to be delayed by about 2 weeks after the peak of disease. And so, even once we get to the peak of disease, we will still see the death count likely to keep climbing.
Thank you, Dr. Mackie. And a follow-up question from Celine. Dr. Tam in Ottawa recently has said wearing even a fabric mask is now recommended for those going outside of their homes. Does the MLHU agree? Also, speaking of masks, 500,000 will be released at the US border this week, but that will only go so far. How will we ensure to get proper PPE to our healthcare workers in London?
Yeah, so the question around fabric masks, my understanding of Dr. Tam's comments is that this isn't, a really hard and firm recommendation. What it is an endorsement. If you feel like you want to wear a mask, please wear a fabric mask. Don't use a surgical mask or an N95 that should be, reserved for healthcare, where the risk to both staff and to clients, patients is greatest. Second of all, the wearing a cloth mask may be helpful. I really qualify though, it must be worn properly and carefully, and that it can potentially cause as many problems as it does solve. The main issues when wearing a cloth mask, first of all, some people find that wearing a mask of any sort is irritant to their face, and they end up touching their face a lot more than otherwise. And if that's the case, again, if you're going to wear a mask, you need to be really cautious that you're not touching your face more to adjust it or to itch a scratch. Proper use of a mask is really important, and if it's not done properly, it can increase your risk, not decrease it. Second, there's the idea that masks might be able to replace physical distancing measures. That is not the case. If you're thinking that a cloth mask, or really any mask, is going to be better than keeping your distance from others, you're mistaken. You absolutely need to continue to keep your distance from others. The other aspect of what Dr. Tam is saying is that this cloth mask approach is most useful for other people. So if you're wearing a cloth mask, it actually doesn't protect you particularly well. But what it does is, if you have a cough or a sneeze, or even some of the small amount of droplets that are released from speaking, if you have an illness that you're not yet symptomatic, but you may be shedding the virus already, this can help stop you from spreading the virus to others. So it is, from that side of things, a good thing to do, but please do not think that by wearing a cloth mask or any mask in public that you're completely protected and you can step away from those social distancing measures.
Thank you very much, Dr. Mackie. Our next question is from Dan Brown at the London Free Press, and Mayor Holder, this question is for you. And it's a pretty short one. Mayor Holder, are you still self-isolating? Oh, Mayor Holder, I think your microphone may be muted.
Thanks very much, Dan, for the question. The answer is no. I'm no longer self-isolating from my trip in the United States. I've done 2 weeks as all travelers are expected and required to do. But I won't lie. My absolute sense, and your Cathy makes a reference to this as well, And it seems that the way that we're all conducting our business anymore, it feels like another version of self-isolation. So we're all doing the best that we can to work through this, and that's why people's levels of cooperation are so good.
Thank you very much, Mayor Holder. Dr. Mackie, the next question is for you. This is from Sawyer Bogdan at Global News Radio, AM 980 CFPL. Dr. Mackie, you said that today's low numbers are not indicative of things slowing down. Do we know when we will hit the peak or when things will start to slow down? Can you give a time frame? And a follow-up question for the long weekend. Should people reconsider visiting family members they don't already live with?
Yeah, so brief recap on the question that was alluded to earlier around, do we have an accurate guess of when the peak will occur? We don't know for sure. If I did, I'd take a lot of money and invest in the stock market, because I think you'd really do well if you knew that sort of thing. It's really crystal ball estimates at this point, particularly given the limited data that we have. But we do expect a peak sometime over the next few weeks, not months. On the follow-up, the long weekend, this is a concern. Easter is a major holiday, and the Passover, there are a number of cultural holidays, but in terms of travel in Ontario, Easter is a major driver of family gatherings. And it's actually a very concerning one, because it is often a holiday that brings together multiple generations. Folks, your elderly relatives are at greatest risk. Please do not visit them for Easter. Please find an alternate way, whether it's online or a phone call or however you can. But if you're visiting your elderly relatives this Easter, you are putting them at risk of coronavirus, and it is much more fatal in the elderly than it is in the young. So yes, that is a concern, and I really hope people can adjust their Easter traditions for at least this 1 year.
Thank you very much, Dr. Mackie. Okay, we are going now to Sophia Rodriguez at CBC London. And here's Sophia's question. We've seen cases in our long-term care homes and seniors facilities. We know that many nurses and PSWs work at multiple facilities. Are there any measures being taken to ensure that these workers refrain from going into other facilities, as they may be carrying in the virus while not presenting any symptoms? Dr. Mackie, I think this is one for you.
Yes, absolutely. What we call cohorting of staff, or limiting where staff will work, is an incredibly important part of the response in long-term care facilities and that sort of high-risk setting. It's very common for staff to work in multiple long-term care homes. That's something that the best practice right now is saying we can't do. And we've essentially seen, leading, if not all, long-term care facilities across the region put those sorts of limitations in place.
Great, thank you, Dr. Mackie. I'm going to go now to a question from Scott Kitching at Blackburn News and Free FM in London. This is a question for Dr. Mackie. Dr. Mackie, as a public health professional, what is your opinion on the suggestion that, given we had a severe respiratory illness outbreak in the province less than 20 years ago, Ontario should have been better prepared for this in regards to having enough PPE for hospital and long-term care facility staff?
Well, I would actually challenge the underlying claim that we had a severe respiratory outbreak. Definitely, we had an outbreak of SARS, a coronavirus that's similar in many ways. But what's happening with coronavirus is many, many times greater than what's happening with SARS. With with SARS, around the world, you saw only a handful of deaths, and the case counts were in the thousands. We're now talking about case counts around the world in the millions, so 1,000 times more, or something in that ballpark. What the problem here is that we have a virus that is as severe as SARS, but it spreads as quickly as influenza. So you're seeing case counts that are approaching those or will by the end of this, that are similar to the influenza case counts, but the mortality rate is higher. Should we have been better prepared? I think that there's no doubt that if we'd had better supplies of personal protective equipment, testing, swabs was an issue earlier on, that we could have been better prepared. There is always a question of enough. What is enough? How do you know you are prepared enough? But the other thing is that what we really need to do now is look to the outcomes across our community. And are we able to keep up with the demand that the coronavirus will create, particularly in hospitals and intensive care units? All of what we've done, from the perspective of public health measures, the social distancing or physical distancing, whatever you'd like to call it, all of that is to try and prevent those most severe outcomes. We're starting to see those occur. We have people in the intensive care units in the hundreds now. Are we able to scale up intensive care unit capacity, get the ventilators in place so the hospitals can make it through this and care for those that need that care most? I think we're on the right path. The healthcare system is doing everything possible to be as ready as possible for that peak. I think we're fairly well positioned. Some of the things I would highlight as having gone very well. First of all, compared to 20 years ago in SARS, you have a strong local public health system across Ontario. The government has invested and municipalities have supported across the province strong local public health, and that is crucial for identifying when illnesses are coming to their community, what the impact is, and making sure that people in their community hear about what they can do to protect themselves. I think that has gone quite well across the province. We also have a provincial lab system, which we didn't really have prior to SARS, that is run by the Independent Public Health Ontario at the provincial level, and that lab system has been able to scale up and to make sure the hospital lab system support hospital lab systems to scale up as well, and that's been incredibly valuable to be able to provide PCR testing, which is essentially the gold standard testing within weeks of the coronavirus being identified, and that's now available in all parts of the province, including right in hospital for all of those major academic hospitals. Other things that have gone well, you've really seen excellent collaboration between agencies across the health sector and health sector to beyond. When you're dealing with hundreds of partners and stakeholders, it's never completely seamless, but that's gone very well, and partners have really stepped up to offer the support and assistance needed. I've also been incredibly impressed by the response from the general public, and you heard both the mayor and the warden refer to this earlier. People are going above and beyond to support their neighbors, families, friends, even random strangers. And that community cohesion is a powerful asset that we have in Ontario and here in London and Middlesex. And that is really helping some of the people who are hardest hit by this virus to make it through.
Thank you very much, Dr. Mackie. The next question is once again from Sawyer Bogdan at Global News Radio AM 980 CFPL, and it is for both Mayor Holder and for Dr. Mackie. Mayor Holder, will go to you first, and then when you're done, if you'd like to throw to Dr. Mackie, that would be great. Sawyer's question is, do you believe we have enough physical distancing guidelines in place, or should further restrictions be made? Sorry, Mayor Holder, I think your microphone may still be muted. Go ahead, Mayor Holder.
Sorry, Dan, what I asked was, I said that Sawyer's question cut out a little bit, so can you repeat it, please?
Absolutely. Sawyer's question is, do you believe we have enough physical distancing guidelines in place, or should further restrictions be made?
Well, I think the guidelines are extremely clear. And when we talk about 2 meters apart, I think that's very straightforward. I don't think we need to. I don't think we need to add more focus on that as a question. I just think we need to ensure that some folks who think they're invincible pay attention to this. So part of I'd be interested in Cathy's comments too, so maybe we could just give it to Cathy for her thoughts too before Chris. But it strikes me that one of the messages that I would like to do is say to parents, pay attention to what your kids are doing. We've had a number of ward counselors who have come through and told me that kids are congregating in schoolyards, that in some cases, shoulder to arm, sharing cans of pop. This is nuts. This is not at all any practice of good health. So I don't think that we need to change the rules around this. You've heard me talk earlier about the bylaw enforcement component. I don't know if the County of Middlesex has that as an issue. Maybe Cathy, if you don't mind, maybe I could ask her first and then have Chris respond in terms of the issue around distancing. I just think what we have to do is we have to have our citizens, who again, fortunately, are the minority, pay attention to the risks associated with this. Maybe we could ask Cathy to respond as well.
Warden Burghardt-Jesson.
Great. Well, thanks for that, Ed. So just on call and complaint numbers, the OPP will be responsible, are responsible for any sort of ticketing and that sort of thing, although the lower tier municipalities, such as your Lucan Biddulphs, you know, your Thames Centre, Middlesex Centre, they're working with bylaw, their bylaw enforcement officers, and we're taking the approach, much like you spoke about earlier, from an education standpoint. So should there be groups of people that are meeting either at a park or, you know, you kind of referenced this before, Ed, you know, maybe on a street where they're meeting at 4 corners of a driveway, that sort of thing. Should there be a complaint lodged? We are taking the education approach at this point. And actually, I was on a call earlier today, and there had been only 8, as of Friday afternoon, there had only been 8 formal complaints about those such meetings. But, you know, that's not to say that there aren't concerns about children playing on playgrounds still, or in the park, playing tag, that sort of thing. And unfortunately, I would agree with you, Ed, that, you know, parents have to be responsible for their children today. And I know that there are situations where there's going to be households, maybe there's a single parent involved and they have to work, they're working on the front line, and, you know, they can't necessarily know where their 10-year-old is at all times. However, you know, that's where you have to kind of look to your community for help and support. And that's, you know, you would hope that if I was going to work, you know, I might place an extra phone call to, you know, my son's friends' parents to say, you know, make sure that Johnny isn't where he isn't supposed to be. I think really that's where community has to come together. And as I said earlier, you know, we all have a responsibility to play, and it is difficult. There's no question. It is hard, but we all have to step up. And unfortunately, parents are going to have to really keep an eye on their kids, and they're going to have to police them. There's no other way around that. And then I guess back to you, Dr. Mackie.
Yes. I think that, you know, not a whole lot to add to what the mayor and the warden have already answered here. There isn't a whole lot more to close down. What we really need is for people to respect the public health measures and the physical distancing measures that have been recommended at this point.
Thank you to all three of you for that, for those answers. Warden Burghardt-Jesson, question for you from Dan Brown at the London Free Press, and this actually builds a little bit on what you were just mentioning, and I know you mentioned 8 complaints. Dan's question is this. Mayor Holder mentioned 21 tickets issued over the weekend. Has anyone in Middlesex been fined? And the question to follow up was, would bylaw officers do the ticketing? And I think you mentioned that that is something that the OPP is handling.
So thank you for that question, Dan. So at this point, and the latest statistic I have was Friday afternoon. There had been 8 formal complaints that had been passed through the OPP. I think it's important to remember that Middlesex County is serviced by 2 police departments. One is with the OPP, and then Strathroy has their own police department. And I don't have statistics with the Strathroy Police Department. So the OPP, they are education first, and only in cases of vagrant disregard of the parliamentary orders that have been brought down will they ticket. In some cases, the bylaw enforcement officers will have the ability to ticket, but at this stage, it is education only first. And then I think the sense that I got from the OPP today was, should there be concern where, you know, there's a number of calls that are placed with concern around the same person, or maybe the same area, then that's when you would look at a fine being placed.
Thank you very much, Madam Warden. Dr. Mackie, the next question is for you from Celine Zadorsky at CTV London. Dr. Mackie, we missed the second half of the question around masks. The 500,000 masks that are being released at the US border this week that will only go so far. What are we doing locally to ensure our healthcare workers in London will continue to have enough PPE equipment?
Thanks for bringing us back to that, Celine. The PPE question, particularly around masks, is a very difficult question right now. The manufacturing capacity in Canada is being reassigned to try and produce COVID-related supplies, but in particular for masks, that won't be possible in time to meet the supply shortages that we have now. That is a difficult one because we know that for healthcare workers who are treating the most ill, having a mask on can prevent them from spreading that infection to the most vulnerable, and can make a big difference in the high-risk clinical settings. And right now, the capacity is, supplies are holding out, but if the order by President Trump is heeded by 3M, for example, or N95 masks, that will create a very difficult situation, potentially an untenable situation in Ontario hospitals. You are seeing creative use of masks in terms of the frequency, and we may look at ways that masks that are currently in supply could be reprocessed and reused. That is all being looked at very carefully, and it might be something that has to be done in the short term while we sort out the supply crunch.
Great, thank you very much for that, Dr. Mackie. Question now to, I believe this is going to be for Dr. Mackie as well. This is from Grant Demi at MyFM in Strathroy. Following the recent COVID-19 case in a tiger at a zoo in the United States, should people enact similar social distancing measures in respect to animals and pets? And secondly, because of these cases in animals, is there a concern pet owners may panic and give up their pets for adoption?
Yes, so what we do know is that the coronavirus associated with COVID-19 can reproduce in bats and in cats, in felines, but it cannot reproduce in dogs or most other pets. However, just because an animal may test positive, particularly cats does not mean they can necessarily transmit the illness to humans. We don't know that yet, not to say that they can or cannot, but at this point, it's not something that is very clear. Safest thing to do is, yes, try and do your best with physical distancing, particularly for animals who may be sort of a neighborhood cat that visits many different homes in one day.